So the first thing to understand is that the issue isn't wearable technology. It's data about yourself. And the biggest impact is how people use the data. Individuals can use it to improve their health. Doctors can use it to improve health care. Employers can use it to improve performance, whether it's incentivizing good behavior, looking at the impact of one manager on the employees around that manager, looking at individuals' own performance, whether it's where a lorry driver drives, or whether it's somebody who, when they come in at 8 o'clock, doesn't do very well because they're tired and grouchy, but when they come in at 10 a.m. is actually extremely productive. There's a couple of issues around wearables at work. The first is simply, is the employee aware of what data is being collected and how it's used? And if they aren't, forget it, you shouldn't be doing that. So then they need to be comfortable with that, and then it really is up to the employer to use the data effectively and to respond to it. If something is wrong in a particular division, it's not always about the individual behaviors. It's about a group that is not performing. Is it because of the management? Is it because their office is right next to a train and people get interrupted by the noise all the time? But looking at the data in order to change the working environment, to have everything from tracking lorry drivers and telling them where to drive to telling people to get up and walk around at work because they're too sedentary and they need a 10-minute break to actually clear their mind so that they can get back on the phone and keep making those phone calls. So the important thing is using the data that's collected effectively and transparently.